Hello, I'm Lisa Mirabile, EAC Board Member, and this is the EAC Network's More to Do podcast. And I'm here today with Robert Stricoff, my co-host, who is the Chief Development Officer for the EAC Network.
Lisa,
Hi, Bob.
Hi, how are you? Thanks for having us.
Oh, I'm doing so well. It's a beautiful day out, and it's summertime. What could be better?
It's summertime, people planning vacations, but for us at EAC, there's always more to do.
That's so true. Every day there's so much more to do, and no one knows that better than our guest that we have today. And this is Mary Coyle. Hi, Mary. How are you today?
Hi, Lisa. Hi, Bob. I'm doing very well. Thank you. Thank you for inviting me.
Oh, we're so excited to have you today. Why don't you tell us a little bit about yourself and your position at the EAC Network?
So I'm Mary Coyle. I'm a licensed clinical social worker, and I'm the Senior Director for Senior Services, Nutrition, Education, and Food Services at EAC Network.
That's amazing. So you deal with our senior programs on a daily basis.
Yes, I do. Yes, I'm very proud to be the Senior Director, and we do such great work for the residents of Nassau County. And I'm so happy to be in this role and to make life better for our seniors.
You know, I didn't realize that EAC Network provided Meals on Wheels.
I know, it's amazing. If you look at all of the mission statement and the impact that we make on 60,000 people that we serve on a yearly basis, Suffolk, Nassau, and New York City, you can't forget seniors. And I'll tell you, I'll start the podcast by saying, Mary, I went on a ride-along with a Meals on Wheels, one of your drivers, and I walk up and I say, "Hi, my name is Bob Stricoff," and he says, "Are you kidding?" And I said, "Why would I be kidding?" He goes, "My name is Jerry Stricoff."
Oh, that's funny.
And we're long-lost cousins, and we met each other, in the parking lot of the center in Long Beach, right? And so, Jerry, if you're out there, keep up the great work. I think all of our listeners should go on a ride-along. It's one of the most special moments you can have in your life. Not only are you providing food to a senior who needs it, but when we went, I think we did 4 or 5 stops in a day. And I sort of said, Mary, and you can back this up when you talk about it. I'm like, why is there only 4 or 5 stops? We can make 20 stops.
Right.
And he says, you'll see. So it's not just food. It's conversation. It's keeping them company. The first woman opened the door before we even knocked on it, and she was waiting for the food. But she really was waiting for us to talk to her. So, Mary, I would love for you to talk about Meals on Wheels and the impact that it has in Nassau County.
So we have actually one of the largest Meals on Wheels program in Nassau County. We're based on the south shore of Long Island, and then we cover towns in the middle. The catchment area is divided up by 3 providers, and we have a large pocket of people in the middle and mostly on the south. Our clients range in age from 60 to 103.
Wow, 103.
And actually, it's very interesting because people often think that 60-year-olds, like I'm 5 years from being 60 myself, but a lot of the younger seniors on our program they have a lot of health issues and mobility issues, and they're actually quite frail. And then a lot of our older seniors, 95, and our oldest client, 103, they're actually in pretty good shape. So it's hard to tell who would qualify for the program. We get a range of different people, different abilities, but they're all homebound, they're all socially isolated, and they're not able to make their own food. So that's where we step in.
Right, so it's not just food, right, though, Mary? It's really, you talk about being homebound, and you talk about them being restricted to their home, and that means they're restricted to talking to people. That they're restricted to meeting new people. They're restricted to social interaction. And as humans, right, we need social interaction, whether we're 52, 92, or 103. So I'm sure that that's one of the most important parts of the Meals on Wheels program.
Yes.
I,
And so for a senior who's socially isolated, it's really detrimental to their health. There's studies that show that it's equivalent to smoking 15 cigarettes a day. I mean, it's really bad for your health to be socially isolated, and that's a great part of our program. We have drivers who get to know the clients. They develop a relationship. They have a little conversation every day with them, and the client looks forward to that. And even the drivers too. Like if we have a client who goes into the hospital, the drivers will call and say, "Well, how's Mrs. Jones doing? When do you think she'll be back?" They really care about the clients. But we often get calls from daughters in California or sons in Florida saying, my mom or my dad, I don't think they're doing well, and family support is not often local. People can be in different states, and it's very, very difficult for them. They would actually be called the sandwich generation because they're trying to take care of their elder parents and then their own children. So it's very hard for them to manage it all. And
Wow.
especially during COVID, it was terrible.
And during COVID too, I'm sorry, Lisa, to interrupt. EAC, we're always proud that we continued our operations. We continued to provide food during COVID, which was, obviously hurt and struck a lot of people. But EAC stood right by there every single day and still provided, food and companionship to our Nassau County seniors.
I was just going to say that there's 300,000 people in Nassau County that are 60 years of age or older. And the statistic that I recall from our last podcast that we had when Neela was here, that you provided, I believe, 170,000 meals in Nassau County in 2021. That's a phenomenal amount of meals. And then when you talk about the isolation,
It's 180,000.
Oh, 180,000.
Almost 180,000 meals, yes. And the first year of COVID, our numbers went sky high. We were like 110% higher than normal.
Wow.
It was unbelievable because, at the very beginning, we had to change our model overnight. Basically, we were getting hot food from the hospitals. We were using a lot of volunteers, and we couldn't do that anymore. So we never missed one day, and yet we had to change our model overnight to frozen food.
To frozen food. So now is this a kitchen? Are you heating the meals, packing them, and delivering them? Walk me through, what is the process?
Yeah, so we actually purchase the food from vendors. We have a kosher vendor, and we actually have 2 vendors at this point, and it's the meals are, it's really good meals, and they come to us packed in bags, they come in refrigerated vehicles, and then they're packed, and then our drivers are waiting to take them off the truck. They put them in their vans, and then off they go to deliver the food. So it's all done within under a 2-hour period in the morning.
That's fabulous.
Yeah, it's unbelievable. And so Mary mentioned that we have a kosher menu.
Yes.
I think we have a vegetarian menu. Is that also correct? If people are
Yes, we
asking
can get vegetarian food from one of our vendors. Yeah, and we have really, our food is really nice. And it meets 1/3 of our RDIs, which is the required daily intake. We used to do 10 meals a week, but now we're doing 5 meals a week, and it's assumed that people will have their own breakfast, and they'll use the meal for either lunch or dinner.
So did you see a price increase through COVID because you had to, 1, change your business model, and then 2, 110% increase in the need for seniors through COVID?
We did. We didn't see it right away, but our prices we've had to, pay more. The price of food and gas is just, it's just gone through the roof. So we were affected by that as well. And, the more we pay, the less people we can put on the program. So that's why it's really important that, we don't have a waiting list. Like, we're so proud to say that we don't have a waiting list. we do a comprehensive assessment, and if somebody needs the meals, technically we're supposed to put them on by 10 days, but there's days I'll give approval to put them on the next day or within 48 hours. I mean, we make it happen. We are so dedicated to making sure that Nassau County seniors don't go hungry.
Listen, if there's a car dealership sponsor that's listening, I'm sure we can use an electric car and try to avoid some of the gas costs that are out there. So if any dealerships are listening, please support EAC. We can certainly use an electric car to provide these meals. And as Mary just talked about, we're saving people's lives. You said something about cigarettes, and you said isolation equals if you're isolated, a senior's isolated. Can you talk about that? That was an interesting part, and I didn't want to gloss over that.
Yeah. So the recent studies, I read this on the Meals on Wheels America website, show that people who are socially isolated, it actually affects them physically, and it's detrimental to their health, to the equivalency of smoking 15 cigarettes a day. So if you're socially isolated, you're not talking to anyone, it can really negatively affect your health. People don't realize that your emotional well-being is really important, just as important as your physical well-being.
Absolutely. I know that when I'm walking down the street and someone smiles at me, I feel better, right?
Yeah.
So if I'm in a room or in my house all day and then all of a sudden I'm greeted by someone, if I was isolated, I'm sure it would have an effect on my mental health. And when you think about, seniors, and you said it, right? Our families are everywhere today, right? Most of us don't live in the same town with our entire family. People are everywhere. So you don't have the support as a senior that you used to have, generations ago. Our children are leaving, right? They can't necessarily afford to be here themselves, and we're left alone, and that is isolating. That has a mental health issue. It has a, nutritional and medical issues that can come up. So this is a very important program. So everyone that's listening today, I'm going to put in the sales pitch. Please go to the EACnetwork.org. There is a button there that says 2022. That's our ongoing donation campaign for 2022. We're just asking for $20.22. Help us feed a senior. Please get on your computers, on your phone, click that red button, and make the donation today.
Yeah, thank you. That's very important, and we also need to spread the word, right? I think part of it is that people think of Meals on Wheels that someone else does it, or the government does it, or that it's a handout. It costs money to provide these meals, and as Mary talked about, the cost of gas is a big factor in that cost. So it's a program that EAC is proud of. I know Mary's proud of that she runs this program. It's one of our spotlight programs because it affects seniors every single day. So please support EAC. Go to our website, donate $20.22, and then share it with your friends because it's very important that we tell people about what we do and the impact that we have on seniors in Nassau County.
Well, that's just one thing that Mary does, right, Mary? You have in-home care, correct?
Yes, we do. We also provide senior case management, and that's another wonderful program because in that program, when we get a referral, we actually send a case manager to do an in-home comprehensive assessment. So it takes a look at all the needs. We can link the senior to services, including home care. We can do a Medicaid application, apply for food stamps. We can, depending on the circumstances, we can try and link the client to any services that would allow them to live, to stay in their home and to live with dignity. And, because nobody wants to go into a nursing home.
Yeah.
The people want to stay in their community, and that's what's great about this program. We can then, if they qualify, we can get them up to 20 hours a week in home care with an aide. And there's a cost share for that program, and it's based on a formula, but for very low income people, the cost can be zero. So it can be a free service.
And where can seniors find information on this program if they need help? Who should they be calling?
Yeah, they can go to our website and they can also call our Long Beach office. If you
And
like, I
what's the
can give you
number
the
for the
phone
Long Beach
number.
office?
You want me to say the phone number?
Yeah, sure.
Okay, it's 516-992-0081. And anyone can make a referral, either the client themselves, a neighbor, a daughter, a family member, a doctor. We get referrals from all over. So if you would call that number, we will complete an intake form, and a case manager will make a home visit, and that's a free service. We're sponsored by Nassau County Office for the Aging, and it's really a great program for seniors who need a little more help to live independently.
And keep them safe, right?
Keep them safe, absolutely. Yes. Yeah.
Mary, this comes to you make a point about this program and how we're helping seniors. It makes me think of Carol O'Neill, your predecessor, and of course, she was tragically passed away. Worked at EAC, I think, for 35 years. Can you talk a little bit about Carol and her legacy, the work that she did for EAC and for seniors, and her legacy that you and all your staff still to this day talk about?
Yes, yes. We miss Carol terribly. Carol was she was a geriatric social worker. She was dedicated to the seniors. She loved her work. She was a dynamo. She had more energy than us all put together. And, when she passed away, we were really sad. And, I have very big shoes to fill. I'm trying my best. And there's times that I'll say to myself, even now, wonder what Carol would think about that.
Oh, wow.
Yeah, she was a great colleague, and she was a great mentor. Even though I've been with EAC since 2015, but I've worked with Carol for over 20 years. Yeah, I've been in senior services a long time myself, but Carol she was just wonderful, and Carol was a great advocate for seniors. If she got a call, she would, and she felt strongly that person, she wanted to help, she would have bent over backwards to make sure that the person got what they needed. And I try to emulate that, and I'm passionate about the work myself, and I'm really happy to to be in this role. I think it's very fulfilling, and it gives me it's a great feeling to know that you're really making a difference in somebody's life. It's not just on the surface, but it's you're really making a difference.
Yeah. Mary, what brought you to working with seniors, and what brought you to the EAC network? I know you introduced yourself, but tell us a little bit about you and what brought you here, and what's your passion? I mean, I can hear it through your conversation, but what's your passion with the work that you do?
It's so funny, Bob. I've had an interesting background. I was actually born in Derry in Northern Ireland, and I'm the oldest of 13 children.
Wow.
Wow. A good Irish Catholic girl.
Yeah. It's not hard to figure out what religion my parents were, but family was very, very important to us, and my grandparents were a big part of the family, and I always loved hanging out with my grandparents. And I loved I loved and respected the role of elders, and I think that from a very young age, that's stuck by me. Um, I actually came out to this country when I was very young, when I was, I believe, 20, and I worked as a nanny in Greenwich, Connecticut. I hadn't went to college, and I saw how the other half lived. It was a very interesting experience, because I was born actually in Derry was a war zone when I was growing up, so there was a lot of anti-oppressive practice, and it was difficult growing up in a war zone. So I wanted to get away for a year, and I thought, well, because I have experience with, I did a course on early childhood development for about a year at our local college, and I got this job as a nanny, and then I decided I wanted to move to San Francisco for a couple of years. So I did that, and I really enjoyed it. It was a great learning experience. But then I decided, you know what, I want to I want to have a formal education, and I decided to go back to Ireland, and I did a bachelor's degree in social work. So that really opened my eyes to how, um, the way I grew up, we were under the British system, and it's complicated, but it was basically, I was living in Northern Ireland in a era when, Catholics were discriminated against. And so I decided then, after I finished my degree and my bachelor's degree, I applied for a master's degree at Hunter College, and I got accepted. So I was really happy. I did a master's degree for 2 years, and I did elderly mental health and working with seniors. And I worked at a clinic in Brooklyn for my internship, and I absolutely loved it. I said, wow, I really want to, I want to specialize in working with seniors. It really, it just made so much sense. And it was a natural kind of, I wanted to go down that path, and it all started to come together. And then after my master's degree, I did community mental health. I did counseling, and I really enjoyed that too. But I liked a bit of both. I liked the administrative and the seeing clients piece of it. So I ended up at Visiting Nurse Association of Long Island, and when they closed down, I moved to EAC, where they took a contract for the home delivered meals and case management.
So the legend is, no. So Mary's being humble. When she left that position, the Meals on Wheels came with her to EAC. So, and that is, I'm sure, very true. And she's being very humble. But when she left that agency, she brought the Meals on Wheels money and support program to EAC. So, thank you so much for that.
So, Mary, how many people actually work within your program? How many people does it take to provide these meals to our seniors?
So for the Meals on Wheels program, we have 10 drivers, and we have an additional staff of 4. So yeah, it's 14 people. And we also have a few volunteers who've been with us. One guy who's a fabulous volunteer has been doing it for over 20 years. So he does it on his own time, uses his own gas, everything, for 20 years.
Wow.
Are you looking for volunteers?
Not right now, because we, the volunteer piece of it is a little harder, and we don't, any openings we have is just, any new clients goes on the paid drivers list.
Got it. And then you have the in-home care.
Yes, we have senior in-home respite as well. And that's a fabulous program. We have, so Christine Weber is the director of that program, and she provides, her and her case manager provide training to caregivers to provide in-home respite and give caregivers a break. And that can be up to twice a week for 6 hours.
How many people work within that program?
Oh, sorry, 2 people, Christine Weber and Deborah Marks.
Very good.
And who are your partners in the Meals on Wheels? Who are our vendors, whether it's Nassau County, or who are the people that are helping us, get these meals to these, seniors? So
Nassau County Office for the Aging provides the funding, and we have 2 vendors. We have A&G Foods in Hauppauge, and Sally Desert is the contact person there. And then we have Maison, and they are a kosher food vendor, and they're based in Woodside. And David is the contact person.
And how long have they been with EAC? How long have they been providing food to our seniors?
Maison has been with us for, I believe, 20 years.
Wow.
And A&G, I think just the past 5 years.
Wow. You need corporate partners, right? You need private partners out there supporting EAC, supporting Nassau County, and supporting this program. So thank you to those vendors that are supporting the EAC Meals on Wheels program. Thank you.
I'm sure we couldn't survive without our corporate sponsors and our corporate partnerships. So it is very important.
Yeah.
And like I said, for more information on how to get involved, you can go to the EACnetwork.org. That's EAC-network.org.
Mary, this is the More to Do podcast. So the floor is yours right now. If you were talking to, we lobby city and state council members, state legislators, for more money and more funding. Give us, it's 90 seconds, right? You don't have a lot of time with these elected officials because they deal with a lot of other not-for-profits, and they're all wonderful, right? I think we're the best because I think our impact, you see it every day, right? You see it in our streets. You see it in our neighborhoods. The impact is not, someplace else. So if you had 90 seconds and you were talking to, a state legislator who was voting on whether we should support EAC or another group, what would you say in 90 seconds to that legislator?
I would say please continue to support EAC. We provide Meals on Wheels to the people, to the most vulnerable seniors in Nassau County, seniors who have made this county what it is today and who are now at the end of their lives and need a little support. They deserve to stay in their own home, to be independent, and to have these meals so that their nutritional needs are met. We the more funds we have, the more people we can put on the program. We never want to be in a position where there's a waiting list. And, we are concerned about that right now because the cost of food has increased exponentially. And we're afraid that people, especially low income seniors of color, we want to make sure that we can reach them, that we can put them on the program, and that they don't go hungry. And we feel that that's really vital work that we're doing. And the more funding we have means that the less people will go hungry.
Well, I can't say any better than that. The more funding we have, the less people go hungry. So, thank you for today. I really, I know I appreciate it. I think our audience learned a lot about not only Meals on Wheels, but all the programs that you're working on for the EAC network. And again, if you can make a small donation, $20.22, if you can text EAC 2022 to 53555.
That's 53555.
Right. EAC 2022 to 53555.
Correct.
I got it right.
You got it right,
without
Robert.
the script
That's
in front
great.
of me.
That's right. And again, the impact of EAC affects us right here in our own communities, not outside. So let's do something that'll impact our neighbors, our family, our friends that are right here, Long Island, Brooklyn, Queens, and Buffalo, right? Now we're in Buffalo. We have some programs up in Buffalo.
We have some programs upstate. We're trying to grow programs upstate. We're working on that. That's the next podcast.
All right. So there's always more to do here. And thank you, Mary, for joining us today.
Thank you, Mary.
Thank you so much. My pleasure.
Bye-bye.
Bye.
Bye-bye.